My name is Kim Kucharski, and I'm a third-year internal medicine resident at the University of Utah. I would like to thank and acknowledge my mentor and senior author of this manuscript, Dr. Doug Adler, and a thank you to Gastrointestinal Endoscopy for this great opportunity. The manuscript I will be discussing today is a comparison of technical failures and patient-related adverse events associated with 3 widely used mechanical lithotripters for ERCP, insights from the FDA Manufacturer and User Facility Device Experience database, the MAUDE database. As many of you know, mechanical lithotripsy is a commonly used, effective method for fragmenting large biliary or pancreatic duct stones. It is a procedure that is used frequently by advanced endoscopists in daily practice. Despite how often the procedure is completed, there is little real-world data available on the most commonly reported complications and modes of failure associated with mechanical lithotripters. There are some reports that the overall incidence of complications is approximately 4%, though little data is available of the etiologies of those complications. Therefore, our study analyzed the post-marketing surveillance data from the FDA MAUDE database for 3 commercially available lithotripters used during ERCP. These include the Trapezoid RX by Boston Scientific, LithoCrush by Olympus, and the Fusion Lithotripsy Extraction Basket by Cook. We reported the most common device malfunctions and patient-related adverse events associated with each device. We analyzed medical device reports reported to the MAUDE database from 2010 to 2021. A total of 1,128 medical device reports were available for data extraction, with findings of 2,129 device malfunctions and 205 patient complications. The most common technical failures varied by device, but overall were related to basket entrapment, separation failure of the basket tip, issues with the handle, or an issue related to the guide wire port or sheath. Other less common issues included fracture of the basket wire and fracture of the non-basket wire. These failures were specific to the individual and unique features and designs of each device and can be described further detail in the manuscript. As mentioned previously, patient-related adverse events were also reported. The most common adverse events for all 3 devices related to patients was the need for an additional procedure to remove an entrap basket. Less common events included perforation, bleeding, and infections such as cholangitis or pancreatitis. Again, each of these events varied by device, as can be further described in our manuscript. We believe this data is important to review and describe in order to raise awareness for the potential risks in order to help reduce patient harm. This is the largest available report of the safety of mechanical lithotripters in real-life clinical practice, and we believe that it is important for gastroenterologists to recognize the risks associated with these commonly used devices for this commonly done procedure. The data for this study is largely descriptive, given the limitations of the MAUDE database reporting system. It is difficult to calculate and report the incidence of adverse events because the total number of devices used during the research timeframe is unavailable. Additionally, it is difficult to compare actual complication rates between the 3 devices because the database does not report the total number of ERCPs that use mechanical lithotripters or the total number of devices used during this time frame. So to summarize, mechanical lithotripters are commonly used devices for complex stone extraction during ERCP, with little real-world data available on device malfunctions and adverse events. We believe that understanding these complications is crucial to their safe operation and can help inform device selection and operation and help reduce device failures and patient-related adverse events. We believe that ongoing user education and surveillance of safety profiles and failure modes of mechanical lithotripters is warranted. Thank you for listening to this video, and if you have any questions, feel free to reach out. Thank you so much.